Most women think that you need pelvic floor therapy if you're leaking urine or maybe after you had a baby, but that's not true for most women. What if I told you that there's actually a lot of different signs that you need pelvic floor therapy and that your issues might actually be coming from the pelvic floor muscles and not what you think they are? Hi, I'm Dr. Brenda Heineke, physical therapist and owner of Revitalize Physical Therapy. And I'm going to show you the 5 sneaky signs that maybe you need to check out pelvic floor therapy. So the first one is low back pain. Also hip pain. So most women don't realize that the back and the hip are very closely connected with the pelvic floor. You see, the pelvic floor is the main stabilizer of the pelvis, and what also attaches onto the pelvis? Your hip muscles and your back muscles. And so when you are moving and doing activities, all of those muscles are working together in a perfect world. The problem is they oftentimes become disconnected, or something isn't working optimally, and then the other ones have to take on more of the demand in order to help you do the activities you want to do. So oftentimes we see women coming in with low back pain that sometimes moves around, it changes locations, or they've tried a lot of different things and just nothing has really quite made the lasting full resolution that they are looking for. Or sometimes pain can even kind of wrap around onto the side of the hip. We also see oftentimes people misdiagnosed with hip labral tears that has nothing to do with the hip, and it's all coming from the pelvic floor. So I tell people that if you have these issues and they aren't resolving within 2 weeks, if you've been trying other things, also like stretching or exercises, and still not having resolution, a pelvic floor therapist is a really good person to look at it, because they're going to look a little bit more comprehensively than just at the back or just at the hip. The other sneaky sign, number 2, is constipation. When you have constipation, your pelvic floor muscles are most likely not working optimally. Oftentimes what we see is that the muscles actually get too tight, or overactive is a technical term. And they're kind of just holding on, and they don't fully relax. And every time you go to the bathroom, those muscles need to fully relax to let things come out when they're supposed to come out. But the problem is they don't do that, and they're just stuck here, which makes it really, really hard to actually go to the bathroom. And it's this vicious cycle that feeds each other, because then if things aren't fully relaxing, it can create more disruption within your GI system, making it more likely to have constipation issues. It's also sometimes when you have constipation and now you're straining to go over and over and over again, that creates more problems on the pelvic floor. It makes those muscles tighter because it's so much force and pressure pushing down through them. So the vast majority of people that have pelvic floor issues also have constipation issues. So if this is something that you've been dealing with, definitely highly recommend pelvic floor therapy, especially if you have any other symptom that would indicate pelvic floor issues like leaking or pain or pelvic pressure. Anything like that with constipation definitely is coming from pelvic floor. Okay, number 3 is pain with sex. Now, a lot of women are told that they're having dryness and they just need to use more lube. And while yes, sometimes that can definitely be the case, especially if there's some hormone change happening there, a lot of times any kind of pain or discomfort is not normal. So if you have tried using lube and you're still having pain, the issue is the pelvic floor. It's not a dryness issue. So just using more lube just isn't the solution for it, because there is a deeper problem. And that pelvic floor oftentimes gets overactive, like we talked about, and that creates pain. So I always kind of tell people, if you're having pain, a really good rule of thumb is most likely that pelvic floor is overactive. So definitely another sign that you need that. Number 4 is core weakness. We see a lot of women that come in and they have been doing all the exercises and trying so hard to strengthen their core, but it just isn't happening. And they say, no matter what I do, it still just feels weak, or I don't feel supported. Or we see so many runners that are trying to strengthen their core for running, yet just feeling like it's not making a lot of progress. And that's oftentimes because pelvic floor isn't included with this. They're not working together. And like the back pain issue, we need the core and the pelvic floor to work together in a perfect world. And there's oftentimes this disconnect. This is so common in women that have had children, that have gone through pregnancy, because during pregnancy, the core muscles, they kind of shut off. They're being stretched and they can't contract very well. And after you have the baby, they don't just automatically kick back on. You have to retrain them. But that also creates a disconnect between the pelvic floor and the core muscles. And so in order to really feel strong and stable, we have to be including the pelvic floor with core, with the exercises that we're doing when we're trying to strengthen. And then number 5 is one that a lot of women don't know, and that is urgency. Now, urgency can look like a lot of different things. So many women tell me, oh no, I don't have urgency because I just held it too long. And the true definition of urgency is it kind of hits you out of nowhere. Ooh, I have to get to the bathroom really bad. But oftentimes women don't put 2 and 2 together. They just think that they've held it too long, or that they weren't paying attention, and now, you know, it's more sudden because they weren't focused on it and they were distracted. But whenever it's this sudden onset of, I have to get to the bathroom, that is urgency, okay? And maybe you leak, maybe you don't, but that kind of sensation that you need to get to the bathroom quickly, and it's very strong and it feels like you can't hold it, that is urgency. And when there's urgency, there's pelvic floor issues, because the pelvic floor tends to drive those sensations and those signals that you're getting. The pelvic floor and the bladder are all sitting right together. And so when the pelvic floor muscles get overactive, they can trigger this urgency. They can also irritate the bladder. And oftentimes women just think that they're going to stop drinking as much water or decrease their coffee intake because they think that that's the reason why they're having these strong urges to get to the bathroom. But that's really not the driver of it. The issue comes down to the pelvic floor. So if you have any of these 5 problems, then I highly recommend considering looking at the pelvic floor a little bit deeper. And if you want a little bit more help on how we assess the deeper systems driving some of these other problems in addition to the pelvic floor, then go take our women's health assessment so that you can figure out the right pieces in the right order to finally have a solution that gets you answers. So go click the link and I'll see you on the next video.